Hey y'all, it's Carter. It is July 8th, or July 9th at 7 o'clock, and that makes it 2 months and 2 days post-op and almost 10 months on testosterone. I wanted to do a quick video to show you guys how my chest was healing and just talk about the last couple of weeks, how I've been caring for it and hoping that it heals as best as is possible. So for the last 6 weeks I've been using ScarGuard, which is a topical gel that you put on the scars twice a day, and you just leave it on. It creates it dries out, so it creates a strip over the scar and it kind of protects it. And 6 of those 8 weeks I was putting Neosporin and Band-Aids on my nipples to make sure that they didn't dry out and to protect them and everything. So I wanted to show you guys how I was healing. My last video was just the reveal, and it was pictures for the 2 weeks right afterwards, so I'll include some pictures at the end of this that shows the progression of healing. But I wanted to just show you guys how it looks and to talk about it a little bit. I'm really happy with how it is, so I don't really have a lot to talk about. Let's see if I can do this. Okay, I don't know if you can see this, but this is my chest, 8 weeks post-op, 2 months I guess. This is the first drain hole right here, and the incision and the nipple, and then this is the left incision and the left drain. Alright, so going right to left, this drain hole looks really good. This one healed up right away, and it looks just like an extension of the incision and hasn't given me any trouble at all, so I'm really happy for that. This scar, this one is darker than the left one, and a little bit wider. I mean, you know, it's hard to tell, but this is probably the widest part of all my incisions and the darkest part. And in the last week or so, it's lightened up, so I have hope that it'll get better in the next month or two. This incision is healing up a little bit better. The scar is a little bit lighter and not as spread out, so that's looking really good. And then this drain hole was the one that gave me trouble. It really just didn't want to heal. I still had a Band-Aid on it until like 4 or 5 weeks after the operation, just because it didn't want to close up all the way. But in the last week or two, it really has, and it looks great. My right nipple is kind of like my special nipple. It's a little more oblong shaped, and the projection, I believe, is going to be hopefully right here, but whatever the outer part of the nipple is called, it's really flat right here. So I don't know if that, it's raised everywhere else and it looks like this except for this little section right here. So I don't know what that means, but I don't really care. Nobody's nipples look exactly the same, and if that's the worst of my problems, then that's cool. My left nipple looks a whole lot better though, and it's pretty much perfectly round, and the projection is right in the middle, or will be. Both of my nipples are still raised, and where the projection should be is kind of cratered in, but Dr. Garamani said that was normal, so I wasn't really expecting anything else yet. I didn't really have any swelling here, and I had a little bit right here. It hasn't really gone down, but I've got another month of the post-op healing, at which point, if it hasn't gone down by then, honestly, you can't really tell. So it's like minuscule. But that may still go down. It's just this little bit right here that doesn't quite match over here. And I'm really happy with the scar placement. I really feel like it hits right along. My muscle line goes right up here and then right here. So it doesn't quite match it, but my pec muscles are really small. So if I work out, I'm assuming that this will actually hit where the muscle will be. So that is the result. It's looking really good. Like I said, I've been doing Scar Guard and taking vitamin E. Other than that, I am almost 10 months on T, like I said. Not too many changes. My voice is leveled out. My hairline is still receding a little bit, but I don't mind. Oh, my acne, I got a prescription for doxycycline, which I've heard some people use. Actually, my sister and brother use it. So I'm going to use that. I have been using that for a week and a half now. My face seems to have cleared up a little bit, so hopefully that'll help. That might be a good thing for anyone to invest in. It's a really cheap prescription, even if you don't have health insurance, that helps with acne. So we'll see how that goes. The only other major change is facial hair is still coming in various, it's still kind of patchy, but it's coming in pretty good down the sides and underneath, a little bit of scruff, but I keep it shaved. So yeah, that's about it. Yeah, I'll make a video in a little while and give you guys another update. Alright, later.